Well, for more on this venture, let's bring in Emma Court, healthcare reporter for MarketWatch. Welcome to the show.
Thanks for having me.
Now, we saw how U.S. healthcare stocks were rattled just by the idea of this new health venture. So what's emerging about what these companies plan to do, and how worried should healthcare companies be?
Yeah, so honestly, we know very little about this venture. We know that this is going to be a separate company. We know that it's going to be kind of not constrained by profits. We know that the first kind of focus of the company is going to be technological solutions. And everyone, of course, wants to have better healthcare at lower costs, and this is a really big problem in the U.S., but other than that, we don't know a whole lot more. That hasn't stopped people, of course, from speculating about what kind of might be the impacts here, what might be the focus. But again, we just don't know. It's very early on.
So why do you think the healthcare sector reacted so negatively?
Yeah, so I spoke to one expert who said this is basically people reacting to the fact that they know there's a lot of inefficiency in the U.S. healthcare system, and kind of the premise that someone might come in and try to kind of clean this up. And I think that's a pretty good point. There's obviously a lot to lose here in terms of profits if U.S. employers kind of shook things up in terms of how they did healthcare, and I think that was kind of this widespread volatility that we saw today.
Now, we've already seen Amazon be a disruptor in so many different industries, many of them linked to its logistical edge. But in terms of healthcare, how well positioned is it to upend an industry like this?
Yeah, it's a really good question. I think we'll all look forward to see how it plays out. I think a big part of this is that Amazon, there's been this kind of reporting about Amazon potentially being interested in healthcare all year, and stocks have been rattled by it every time a new development emerged. So I think that people are plenty scared. I think the way that this will shape out will just kind of remain to be seen. It's not just Amazon. These are all big names attached to this project, and they're executives from each of the three companies leading it. So it'll be interesting to see what they come up with, essentially.
And this partnership is said to be for the benefit of these three companies' more than 1 million employees. But could we expect it to expand beyond that?
Yeah, so we did hear Jamie Dimon say that this could potentially be for the benefit of all Americans. Again, how that would shape out, whether they would only apply this to their own companies, we just don't know. They have suggested that it could help other Americans, and certainly all U.S. employers would probably love to lower their healthcare costs at a better patient experience. So I think a lot of people are interested in benefiting from it.
And certainly one of the main goals in this venture is to really bring down the cost for workers. But as we look at some of these costly health epidemics, for example, the opioid crisis, what can these companies do differently from what the government and states are already doing?
Right, so there's actually still a lot of room for improvement in the U.S. healthcare system when it comes to the opioid crisis, specifically about how we manage addiction. There's been a lot of reporting showing that it's really difficult to access these treatment services, that we don't have a lot of good alternative pain medications, and that access to them is still a big problem. So there is certainly room for improvement here, but as to whether this will be a focus of this new initiative or not, it's hard to say. It's certain, though, that if this initiative focuses on sort of chronic disease conditions, which are a big part of U.S. healthcare spending, that will probably be part of it.
So what efforts are other players in the healthcare industry making to try and put a lid on some of these costs?
Yeah, I mean, there's been a lot of kind of work in this area. There have been plenty of big U.S. employers in the past that have tried to band together to make these kinds of coalitions, and they've been of limited and even mixed success. We've seen a lot of U.S. employers try to shift the costs onto their employees through they're called high deductible health plans, and they basically put more of the out-of-pocket costs on employees, so they could be paying thousands of dollars out of pocket for medical services. You have also seen a lot of employers kind of strike up these deals with local health systems and say, if, say, you want a knee replacement, you might go to this local hospital and we have a great deal with them. Maybe it's free, maybe it's really cheap. In any case, these kinds of deals have been aimed at kind of improving access to care, improving kind of the cost for employers. And it's possible that this new alliance might try something like that.
And why do you think this alliance didn't include any traditional healthcare companies in the plan? Could that perhaps be a bad thing?
Well, it certainly was a bad thing for those traditional companies' stocks today. I did have one person tell me today that this kind of employers have been asking more of their health insurers. They've wanted more sophisticated kind of ways of making sure that outcomes are done well. So in other words, paying health systems or doctors for having better patient outcomes, and that they haven't seen that much progress on that front. Certainly, it's kind of a big ask. It's a complicated thing to measure. But there is this suggestion from U.S. employers that we want more interesting tactics being used on these rising costs. And health insurers have been doing pretty well in this landscape. They've been recording pretty good profits every quarter, quarter after quarter. So it seems like the motivation here is you have these three companies known for disruption, known for kind of inefficiency and believing
Right.
in the markets. And this is a market that people do think is relatively inefficient.
Well, thank you so much. Emma Court there from MarketWatch.